Now I have the distinct honor of moving to the next part of this session, which is looking to the future, as well as acknowledging the great work of our abstracts this particular session. So if we could go to the next slide deck. Again, it's my distinct pleasure to present some awards next. So the first slide, here we go. Oh, actually, looks like we don't have quite the right deck here. That's okay. So I have here written out at least the poster awards for this poster session from last night. On behalf of the conference chairs as well as the abstract selection committee, there were 3 posters that were selected for being exceptionally good. And the first is what they entitled a Special Collaboration Prize. It was awarded to Dr. Queralt Sarah Campubri from Vall d'Hebron Institute of Oncology in Barcelona for her abstract entitled Human Metastatic Cholangiocarcinoma Patient-Derived Xenografts and Tumoroids for Cancer Studies and Drug Screenings. And the second special, and unfortunately, Dr. Campubri was not able to attend in person. The second abstract award was presented to Dr. Edward Jarman from the University of Edinburgh for the abstract entitled Identifying the Earlier Molecular Events at the Interface Between Liver Regeneration and Tumor Initiation in Cholangiocarcinoma. And the last abstract award, which was also presented in the basic science session earlier today, goes to Dr. Nirjan Awasthi for his abstract entitled Inhibition of Serotonin Biosynthesis by Telostat Ethyl Augments Chemotherapy Effects in Cholangiocarcinoma. So join me in a round of applause for these 3 excellent abstracts. All right, now we can move to the fellowship slides, please. So it was my great honor to this year serve as co-chair of the 2022 Cholangiocarcinoma Foundation Fellowship Selection Committee, along with my co-chairs Nilo Azad and Donald Kapak, and about 15 other Cholangiocarcinoma Foundation members who served as committee members as well. And I think each year that I've participated in the Fellowship Award Selection Committee so far, we've seen an increased number of applicants submitting proposals, and the quality of these proposals has been truly outstanding. And I come away from the process feeling extremely grateful to the foundation for all of the fundraising that has made these awards possible. And we saw at an earlier session that the number of awards has increased exponentially. As you'll see, we have 11 awards, not quite exponentially, but at least arithmetically. We have 11 awards to give this year compared to, I think, 7 the year before, 6 before that, and previously around 4 or 5. So the fundraising is something of enormous impact, and that the gratitude to the foundation and to all of the donors who have contributed. I think also gratitude to the enormous volunteerism of our colleagues and in the foundation who have given so much time and expertise in reviewing these, and to the investigators who are really working so hard to make a difference in this field. I think the other emotion that I come away from this process with each year is inspiration, just an admiration by how skilled all of my colleagues are, their depth and scope of knowledge, and by the investigators who, even though quite junior, have amassed such an impressive body of knowledge to come up with such great proposals. So with that rather lengthy introduction, I will start with, here are the poster abstract awards shown here that we just presented, but now turning to the research fellowships. So the first one, in memory of Andrea Lynn Scott, goes to Marina Varela from the Icahn School of Medicine at Mount Sinai with the project entitled Harnessing the Microbiome for Precision Cholangiocarcinoma Immunotherapy. And the second award this year, the Supriya Shup Saha Memorial Research Fellowship, goes to Dr. Srinath Chapara from the University of Michigan for a project entitled Targeting the Mitochondrial Metabolism to Sensitize Chemo-Resistant Cholangiocarcinoma Tumors. The third, Margaret M. Brown Memorial Research Fellowship this year goes to Michael Lidsky from Duke University, Improving Therapeutic Efficacy and Durability in FGFR2 Fusion-Positive Cholangiocarcinoma. Next, I think Cecilia was actually here earlier. I don't know if she's here. Oh, yeah, wonderful. We have an actual awardee present tonight. So congratulations to Dr. Cecilia Monge from the NIH National Cancer Institute for a phase 2 trial for correlative work related to a phase 2 trial of pembrolizumab and CDX-1140 in combination with CAPOX in patients with advanced biliary tract cancers. So congratulations, Cecilia. I should pause here and say that most of these awardees are not here in person this year owing to all of the challenges with travel, but we will welcome them and congratulate them in person next year when they'll have a chance to present their work in a poster session or in an oral presentation. So moving along, the next awardee is Dr. Evan O'Loughlin from Massachusetts General Hospital Cancer Center and Harvard Medical School, modeling FGFR-driven biliary tumorigenesis and therapeutic response in 3D, and I think this is probably cut off models, I'm assuming. So I apologize for the short title there. And let me backtrack. A very important point I missed was that this was the Mark R. Clements Memorial Research Fellowship going to Dr. O'Loughlin. And then the Sarah Bennett Memorial Research Fellowship this year is being awarded to Dr. Judarop Fecharabaranan from the Kankan University in Thailand for his project targeting serum metabolomics for identification of panel bile acid marker-specific ovivirine infection, liver morbidity, and cholangiocarcinoma. And the Jacques Dupont Memorial Research Fellowship this year will go to Rutger Jan Svindenberg from Amsterdam, UMC, Netherlands, for a project, Clinical Translation of Integrin, I can't say that, apologies, Targeted Molecular Imaging for Cholangiocarcinoma Detection, MIMIC. And then the next 4 fellowships are all sponsored by the Kathleen and Paul Sittenblad Research Fellowship. The first to Alessandro Gambella from UPMC Montefiore, Precision Pathology in Cholangiocarcinoma, the role of immune synapses and vascular framework in patient management. To Kishore Pant from the University of Minnesota on the role of primary cilia in EGFR signaling regulation in cholangiocarcinoma. To Dr. Vindya Vijay from Massachusetts General Hospital and Harvard Medical School, understanding the role of loss-of-function BAP1 mutations in pathogenesis of cholangiocarcinoma. And last but not least, to Dr. Daniel Zabransky, who played a role in Dr. Wu's talk as well, from Johns Hopkins School of Medicine, from Mark, Dr. Yorshman's talk. So I believe that's 2-hydroxyglutarate as a modulator of fibroblasts and anti-tumor immunity in the IDH1 mutant cholangiocarcinoma tumor microenvironment. So with that concludes our 11 awards this year for the Cholangiocarcinoma Foundation 2022 Research Fellowship process. And I think it's a perfect way to, a bright note to look towards the future at the end of a great conference. I know for many of us, this is our first foray back to the real world after 2 years of virtual meetings. And again, I think this is an inspirational note of hope that we can look forward to these great projects and these young investigators to bring our next round of research advances and hopefully breakthroughs for the future in cholangiocarcinoma. So thank you very much to all of you.